I am Professor Rama Prasad. Diabetes affects millions of people worldwide, and its prevalence continues to rise every year. In this video, I'll explain what diabetes is, the different types, and the main causes so as to understand it clearly and take action. Have you noticed unusual thirst or frequent trips to bathroom? These can be early signs of diabetes. Understanding it is the first step to prevention and better management. Diabetes is a group of conditions where blood sugar levels are too high. When we eat carbohydrates, they are broken down into glucose, which enters the bloodstream. Insulin, a hormone from pancreas, helps your body use glucose for energy. It also tells the liver to store extra glucose as glycogen, keeping blood sugar levels in balance. When insulin is in deficit, our cells become resistant to its effects. Muscle and liver cells cannot effectively utilize or store glucose. Consequently, glucose accumulates in the bloodstream, leading to hyperglycemia. Over time, high blood sugar can cause serious problems affecting the heart, blood vessels, eyes, kidneys, and nerves. In types of diabetes, type 1 diabetes happens when body's immune system attacks and destroys the insulin producing cells in the pancreas. As a result, a little or no insulin is made. It can develop at any age, even in children, teens, or adults. While the exact cause is not fully known, genes play an important role. People with type 1 diabetes needs insulin for life, which is why it is often called insulin-dependent diabetes. Type 2 diabetes happens when the body's cells do not respond well to insulin or when pancreas doesn't make enough of insulin. The pancreas may still release insulin, but the cells in muscle, fat, and the liver ignore its signal. This means glucose stays in the blood instead of going into the cells for energy. Over time, this leads to high blood sugar, a problem called insulin resistance. Being overweight, inactive, or following an unhealthy diet greatly increase the risk of developing type 2 diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy. In most cases, it goes away after the baby is born. But it is important to know that women who experience gestational diabetes have a high risk of developing type 2 diabetes later in life. That's why regular checkups and a healthy lifestyle after pregnancy are so important. Pre-diabetes is a stage where blood sugar levels are higher than normal but not high enough to be classified as diabetes. If it is not managed, it often progresses to type 2 diabetes. However, maintaining a healthy weight, eating balanced diet, and engaging in regular physical activity can significantly lower the risk and even reverse pre-diabetes. Diabetes is a complex condition shaped by genetic, lifestyle, and environmental influences. Reduced physical activity and widespread intake of high calories diets have fueled its global increase. While genetics make some individuals more vulnerable, lifestyle choices such as maintaining a balanced diet, regular exercise, weight management, and stress management play a pivotal role in curbing the diabetes epidemic. Diabetes doesn't have to control your life. With awareness, action, and support, we can change the story. Until next time, stay strong and stay healthy.
Subscribe to Dr. Ram Wisdom Academy.